is less efficient. So what happens is CoQ10, which is ubiquinone, can't convert to ubiquinol, which is the active form of coenzyme Q10. This is looking at cellular energy. This is looking at reducing oxidative stress. And so if people have this gene variant, that can, cause issues from, detoxification, that can increase risk of any type of cellular metabolism issue. It can increase risk of, muscle pain, joint pain, cardiac stuff. CoQ10 is really important for, enzymatic, reactions in those type of cells. So you could take CoQ10, but if you have this genetic SNP, it's not going to go to the active form, okay? SOD, superoxide dismutase, is a gene that makes superoxide dismutase, and this is abundant in the body. What this does is this helps to get rid of free radicals, okay? We make free radicals, that's essentially additional oxygen molecule, okay? But we don't want lots of free radicals, okay? That's really what causes inflammation, aging, and it can definitely cause cellular changes. So if you have mutations in the SOD, that is associated with infertility, poor, sperm, egg quality. We have the ATG gene variants, and this is looking at degrading cellular debris. And so if you have this genetic variant, you can't break down cellular debris. So that causes inflammation. And we all know that's another, risk factor, right, for any type of disease. If you can't get rid of this cellular debris, that can cause neurological endocrine issues, can increase risk of PCOS, which, has a huge component of insulin resistance, and then that also can increase risk of gestational diabetes. The AOC1 gene variant is looking at histamine degradation. So histamine, we think of allergy stuff, right? Histamine is actually a neurotransmitter. So the body makes histamine. Our mast cells make histamine, and mast cells are white blood cells that are in areas of the body that are in direct line with the environment. So skin, mucous membrane, lungs, sinus, mouth, GI, but also play a huge role in egg transferring, binding to uterus. So we need histamine, but too much of a good thing can be a problem. If you have a genetic SNP and the AOC1 gene, and you don't produce enough DAO enzyme, you will not be able to break down excess histamine, and you'll have weird symptoms that come and go. Those symptoms could be depression, anxiety. Those symptoms could be insomnia. Those symptoms could be infertility. Those symptoms could be allergies. Those symptoms could be GI stuff, high blood pressure, migraines, and this is all from having too much histamine. Our placenta, when we're pregnant, produces 500 times more of this DAO enzyme. So again, to protect baby, protect mom, okay, because histamine is inflammatory. If you have a genetic SNP here, that can increase risk again of miscarriage, premature birth, and can cause the release of immature eggs, which can also cause, which is immature ovulation, even if you have normal menstrual cycle, okay? So what's interesting is, and I don't know if you probably have seen this, but, and maybe some of you guys too, but I've had so many patients that, they had horrible allergies their whole life. And we talked about their pregnancy. The only time they didn't have allergies was when they were pregnant. Or I also see too, when women are pregnant, they get like the mucus and the sinus and all that, and we're all about because it's hormonal change. Yes, it is. When estrogen levels are high, estrogen actually causes the body to make more of the histamine and suppresses the body's production of this enzyme. So if women have, and I would love to see a study on this, but if women during pregnancy, if their allergies were worse or they had a lot of this stuff, I would love to see a correlation to what their pregnancy outcome was, because I would think that if they're having all those issues, they might have a genetic variant on the AOC1, so I don't know. But it's pretty, and when I ask patients, you know, well, what happened to your allergies during your pregnancy? They're like, well, why would you ask that? You know, but they're like, they were gone. Or, you know, what happened to your migraines during pregnancy? They were gone. And again, we think it's a hormonal thing, and yes, it is, but it's not what the hormone is doing per se, it's what the hormone is doing from the histamine standpoint. So, all right, FADS, so this is fatty acid desaturase, and what this does is this modulates your PUFAs, your polyunsaturated fatty acids, okay? So we know that we need omega-3s, right? The body doesn't make them, okay? We know that we get a lot of omega-6s, omega-9s in our diet. We don't get enough omega-3s. Well, if you have a genetic SNP in the FADS, essentially, your ratio might be off. So you might have to take more omega-3 than your friend who's pregnant that can take, you know, whatever recommended amount, okay? And so, you know, and then you might want to look at dietary change, you know, trying to, you know, reduce the amount of omega-6 fatty acids, you know, and things that way. The PEMT genetic variant is dealing with phosphatidylcholine production. So phosphatidylcholine is a fat, and if you have a genetic SNP in this gene, essentially, you're going to have phosphatidylcholine deficiency. And you need phosphatidylcholine for your brain, for brain health. This is like the fat, so it deals a lot with cellular fluidity. It helps with brain, retinal health in baby, and choline is really important during pregnancy because there's going to be choline deficiency when woman is pregnant. The FU2 gene is associated with bad microbiome. So this is looking at gut health and deficiency, especially in bifidobacterium. So we all know how important gut health is to our immune system, to, you know, health overall, but then also to baby. Mom's gut microbiome, okay, is going to be what is going to inoculate baby with baby's first good bacteria when the baby comes coming out the bottom, okay? Because mom's vaginal flora, there's a direct correlation to mom's GI flora. So if mom has this genetic variant and her gut flora is bad, her vaginal flora is probably going to be bad, which will then potentially cause issues with baby's microbiome, which can, you know, definitely lead to colic, you know, eczema, dermatitis, you know, immune issues, GI stuff. So there's things that you can do if you have this genetic SNP to make sure that you have, you know, appropriate, you know, diverse gut, you know, health from a bacterial standpoint. And then this also looks at gluten sensitivity. This is not looking at celiac disease. This is looking at gluten sensitivity. So, you know, a lot of people that, you know, might have infertility, they might do different diets or, you know, get rid of inflammatory foods. It's stressful enough, I think, to worry about what we can and can't eat, and then you're trying to get pregnant, and then you're like, is there gluten in there? Oh, I can't go out to dinner, I don't know what to do, and it's like, maybe sometimes just testing, you know?
I think it's important to do that, and I also think that there's a lot more information coming out about uterine biome and preparing for pregnancy, and it's amazing. So I also do vaginal health, believe it or not. You have to keep your vagina for the reasons that you just stated, but in the fertility population, almost 40% of the patients present with BV, and we often don't